So what I wanted to talk to you about is I see online that there's a coaching aspect that you're offering.
I've been interested in burnout for years. I'm a psychiatrist. I'm the person who's supposed to be helping everybody else. But I hit a very, very severe burnout in my own life back in 2008. It was September 2008 that I hit a significant bottom, and I had seen it coming, right? I was working a lot of hours, and I knew that I was getting depleted and exhausted and tired, and I was just absolutely miserable. And in September of 2008, I was at a bottom. I was in a dark room. I was staring at this picture of my twin sister, Magdalena. And in this picture, she's smiling. She's literally glowing. And what you can't tell in that picture is that she was going through chemotherapy for brain cancer. And she had actually passed away the month before, August of 2008. And looking at that picture, it was just so striking to me. I was absolutely miserable. I was healthy. I had a thriving practice. And here she had lived through her last years with a smile on her face, with a very grim prognosis. And I made a decision to turn my life around and really started making changes a little bit at a time to claw my way back. And the journey that I took and kind of what I learned, piecing things together backwards after I had felt better, I turned into a book, Happiness Rules, Beat Burnout, Embrace Happiness, Become a Better Entrepreneur. What I've learned, I started using to coach other entrepreneurs. So I've had a coaching practice separate from my psychiatric practice for years. And when TMS came along, it was just a game changer in my thinking about what I had to offer entrepreneurs. Before I was good at helping entrepreneurs get through burnout, but I couldn't help everybody. But with TMS, it just kind of made the benefits and the improvements that people needed, entrepreneurs needed, almost inevitable. So I shifted from, just kind of coaching, the aspects of what you need in your life to flourish. And I front loaded that with TMS. So the program that we've developed now is called NeuroPeak Protocol. We have an accelerated TMS for entrepreneurs at the front end. First there's an evaluation, of course, there's TMS. And then after that, we have 12 weeks of coaching, 6 sessions over those 12 weeks that are really honing in on the aspects of their lives that are required for humans to flourish. And most of that material, I pull from my own personal experience, the book that I wrote. And it's got a massive tie, and I didn't really know this till after I'd written the book. But, positive psychology and the science of flourishing is something that psychology has been working on. In med school, all we talk about is pathology, how someone's sick and how we get them better.
Yes.
But the idea of how to flourish is not something that they teach in med school and in my residency in psychiatry. So it's really exciting to be able to offer both of these things to entrepreneurs.
So you have a client who does TMS with you, your protocols, right? And then you have somebody who does TMS and the coaching. Are you seeing a difference in results between these two patients, these two examples?
Absolutely. I think that, TMS can get you out of the funk, whatever flavor of funk someone has. But then really having some concrete ideas of what it means to flourish and what are the pillars that you need in your life to flourish, that can get neglected and people can feel better. But I think what's much more sustainable is helping people understand and implement the aspects of life that really bring them joy.
And they're going to sustain the benefits of TMS longer with the new mindset the new healthy habits and things like that.
No, that's exactly right. And I think, we don't really have this. TMS is still new, right?
Yes.
But that's exactly the hypothesis that we're working under, that if we get people back to, performing at their peak, and now we give them the tools, the healthy habits and mindsets,
Yes.
meaning and purpose and, so on and so forth, that they're going to be much better off.
They can find all of this through you, correct? Do you do that course online by any chance?
The coaching is done one-on-one with me at this point, but there's a agenda, there's a structure, curriculum to the coaching so that they can be reproduced. I don't have an online course. However, the book is available everywhere, and it gives you my insights into what I learned and what also correlates very well with, the science of happiness, the science of flourishing.
I think that's such an important part. I'm not going to say that people miss, but I know people have missed is the rest of this, right? TMS can pull you out of that fog or pull you out of that gutter. But what are you going to do once you're out?
Exactly. And we've known for years, if we go back to the medications, we've known for years that the best outcomes for our patients is when they're doing not just medications, which can help their depression, but, the combination of medications and therapy.